To fulfill the city's vision that everyone share in our community's prosperity, the city, with input from community leaders and residents, is developing an equitable poverty prevention plan to take on poverty.
To be honest, this apartment, we're living in it because we have to.
What's poverty anyway? Quite simply, it means you're struggling to pay bills of everyday life because you don't have the resources to pay for them. The federal government sets a poverty line each year to decide who gets benefits and who doesn't. But it's based on a 50-year-old formula that most experts agree should be at least 1.5 to 2 times that amount. If we listen to the experts at 1.5 times the federal poverty line, then that means 1 out of 4 Dubuque residents lives in poverty. And the numbers are rising. To take on poverty, we need to understand what causes it, what holds people back, and how it plays out in everyday life. So let's look at the determinants that often lead to and keep people in poverty. Prior to the COVID-19 pandemic, Dubuque had a very low unemployment rate. However, for many people living at the poverty line, those jobs were low wages at $7.25 an hour to $10 an hour. It meant they had to work 2 jobs to make ends meet. And the jobs that were paying around $15 per hour, many are only part-time without any benefits. Let's listen to Adna's personal experience and those in her Marshallese community.
Yeah, many Marshallese live in poverty. They work in housekeeping, and some of them, they work at the nursing home. They make minimum wage, but the housekeeping is not good enough. Sometimes it's difficult for me because I work part-time.
Many others in focus groups for this project brought up how a part-time job may pay a little more, but they can't get more hours to support themselves or a family. And then there's what's known as the cliff effect. If you're receiving a public subsidy and are offered, let's say, 50 cents more an hour on your job, it may trigger taking away assistance like childcare and the SNAP program or medical care, throwing people right back into poverty. One of the greatest challenges families experiencing poverty face is the lack of affordable childcare. Without it, the majority of women can't work full-time.
Now I'm on childcare assistance, but before I got that approved, I was paying about $530 every week for 2 kids, about 3/4 of my paychecks. And I was only paid every 2 weeks.
Katie is a mother of 3 and tells us of the struggles of finding and paying for childcare while keeping a job.
To find childcare was actually fairly difficult for me, mainly because all the daycares around here, babysitters, every in-home daycare, actual facilities, they had absolutely no openings.
Children facing poverty benefit greatly from early childhood programs, but the state only offers 10 to 12 hours a week of preschool for 4-year-olds. And for every slot available in childcare, 3 children are vying for it. Only a few employers offer on-site childcare in Dubuque, and after-school programs often face waiting lists or they're unaffordable.
No openings. The only one I was able to find with openings was on the complete opposite town of Dubuque, which is probably about a 5-mile radius. And I, at the time, did not have a car or my license, so it would have been travel by bus to drop them off at bus would run from 6 in the morning until 9 o'clock at night. And I would have to find a way home just to come home, go and pick up my kids at 9 o'clock, and find a way from the opposite side of town just to come back home by 10 o'clock.
Reliable transportation is vital to moving out of poverty. With it, you have access to jobs, you can get to work, you can apply for benefits, you can go to school and pick up a trade, you can get to healthcare providers, drop children off to childcare, school, and activities. But a car is expensive to maintain with repairs and insurance, let alone buying it, and public transportation may not be conducive to keeping a job. Here's America's story.
Okay, let me explain you something. It's impossible to have a car right now because I explain you my income. Pay an insurance is not easy. That's why for me it's hard to have a car right now, because I need to think about the insurance. And that's one of the things is a little bit problem for me, find a job. Because if I find something at afternoon or at night, I don't feel secure return to my house late. The problem is the public transportation. Don't have a lot of bus stop. You need to walk a lot, is you be in the middle of the way. This is a problem.
Finding affordable housing when you're among the working poor is faced with plenty of obstacles. There's the application process, waiting lists that can go on for years, and the shortage of safe, affordable housing to choose from. 63% of housing units in Dubuque do not accept housing vouchers for rent, creating a greater probability of forcing them to settle for less desirable housing. 1/4 of occupied housing units have one or more substandard conditions. This also increases the likelihood of the working poor overextending themselves on rent payments they can ill afford. All of these factors lead people to live in areas of concentrated poverty. Census tracts 1 in 5 in the city are such neighborhoods. Research shows that living in areas of concentrated poverty poses physical and brain health risks among all age groups, but especially young children. It's not surprising then that the numbers of people coming to shelters are also rising. Marie never thought she'd live in a shelter or join the ranks of the unemployed. Here's her story.
I came to Dubuque in 2015, right after my, I think, 57th birthday. So I was doing a whole new me. And I got here, I got a job right away. Things were going well, but like 2 months in, I got sick. And it took everything from me. I had doctor's appointments, physical therapy, just everything. And then finally I went to Iowa City to neurosurgery, and I had the surgery. After that, I contracted MRSA. That was a whole new thing. So it was just brutal. The wound care, the wound vac, 8 weeks of living with this machine attached to me. And during that time, I lost my job. And, I'm like, how am I going to pay my rent? And I stayed in my apartment for a few months before I had to leave. I had to leave right at Christmas time, a week before Christmas that year. Finally, I decided to come to the shelter, but everything that I'd ever known about a shelter, I had seen on TV. So I was afraid. I really was. I was dreading it. I didn't want to do it because everything I had ever thought of a shelter and me and myself, I didn't belong there. And because I thought that you had to be lazy, you had to be a drug addict, or you were in a violent relationship, that was what got you there. And I learned that all you really have to do is miss a couple paychecks and you could be homeless.
A troubling 42% of Dubuquers are overweight, while 1/4 are physically inactive. These two conditions fuel multiple chronic illnesses, and if you're poor, these numbers are even higher and the risks are greater. Psychologists have diagnosed the stress of experiencing poverty as a form of trauma that's led to health disparities among people living in poverty and people of color. Sherry has faced the struggle of not knowing where the next meal will come from or how the rent will be paid. It wasn't always that way until her family lost her dad.
You have to make your way and just be strong and keep your head up, because you can't do that. And that's what he always told me, to keep my head up, and I'm very strong woman. I'm sorry. Because it feel like he's speaking to me right now while I'm talking to you. It feel like I could feel him watching over me, because he know that I shouldn't have to go through what I'm going through right now. You know, I can't call my mom and say, Mom, I need help, because I know she got her own life and her own problems and her bills and stuff to take care of. So I don't like calling nobody in my family for money and everything, because I'm in poverty myself right now. I'm just trying to make ends meet, how to get food in my house every month. Like, I get low on food. I got to go through the food pantries, or I got to call this number to get this food, or I got to call somebody to get some food, or somebody call me and say, did you cook? I'm like, what did I cook? I didn't cook nothing, because I ain't had nothing to cook. So I'm eating at family members' houses and everything. So it's a struggle every day for me. Every day I struggle, every day. But my dad always say, you strong, keep your head up. He always tell me that.
Children and elderly are especially vulnerable to health risks. Both age groups lack access to healthy foods, resulting in obesity, malnutrition, and poor attention spans for young minds. Free school breakfast and lunch for many children is the only nutritious meal they get in a day. There is a wealth gap between whites and people of color. The underlying reasons are why race and poverty are linked, and the facts show it. Racism is systemic, and its harm is wide-ranging. If you can't get a living wage job, which likely means you won't get a loan for a car to get and keep a job, or be able to repair a car when it breaks down, you won't get loans for a mortgage, for repairing a home, or meeting unplanned expenses. It's known as being underbanked. Without access to money, people are forced to pay exorbitant interest rates to payday loan lenders, keeping them stuck in a cycle of debt and poverty. Youth and marijuana arrests make Black youth more vulnerable to being sent on the school-to-prison pipeline versus their white counterparts. National studies show that Black youth have disproportionate school disciplinary and expulsion rates, along with higher arrest rates by school resource officers. Anderson, a member of the Black Men Coalition, explains how the structure of racism and poverty prevent people from a path forward.
Structural racism is another added layer to even just structural poverty, right? So poverty, that impacts everyone. But when you're talking about racial injustice, when you're talking about racism, and the history that we're having in this country, is now it's intentional efforts to put systems and policies and procedures in place to allow there to be winners and losers. And disproportionately, the losers have been, of course, when you look at poverty, it's, middle class, you're starting to see them suffer a lot, and poor people. But when you add the race in there, you're talking about people of color. You're talking about Black and brown people who, again, who have been intentionally and sometimes unintentionally excluded from resources that will allow them to thrive in communities.
Being poor, no matter what race you are, carries a stigma that makes moving out from poverty all the more difficult. Being raised on the wrong side of town, or without the right connections, or the unsaid bias that you brought this onto yourself, makes it all the more difficult to chart a path forward. In contrast to those sentiments, Katie and Sherry, along with thousands in our community struggling to overcome poverty, have dreams, and they're going against the odds to achieve them.
I've been away from school for 20 years, and it's a long time to stay away from school that long. And I end up coming back here, moving here. I end up going back to NICC, get my high school diploma. The next thing is gonna be business or real estate.
The only way I can see getting out of poverty is to keep pushing forward and keep trying for that promotion or trying for the same job that you were just dreaming for and just can't get into right now. That day will come to where they will be able to get you in there.
That's your dream?
Oh, yeah.
The core vision of the Equitable Poverty Prevention Plan is to remove the obstacles that people experiencing poverty and people of color face day in and day out, so they too have every opportunity to thrive and work and share in our community's prosperity. Researchers working on this plan have held focus groups with people experiencing poverty, interviewed community leaders and advocates, surveyed service providers, and have scoured the country looking for promising practices that can enhance the good work the city and the Dubuque community is already doing to address poverty and consider completely new strategies. Taking on poverty won't be easy, but with Dubuque's spirit of solidarity and the city's community engagement through its Caucus for Community initiative, we can reach a day where all of our community shares in a prosperous, equitable way of life.